One of the most common questions that patients ask is, am I too young to have a facelift? Or is it too early for me to have a facelift? And I'm not quite ready for a dramatic, long recovery facelift. And this is where WaveLift really is ideal. My name is Dr. Peter Lee, board certified plastic surgeon at Wave Plastic Surgery, a world's leading clinic. Today, we're going to be discussing what a wave lift is and how it compares to traditional facelift, and what you can expect before, during, and after the procedure. What is a wave lift? Wave lift is our signature mini facelift, a refined, less invasive procedure designed to lift and tighten the lower part of the face and jowls using small, limited incision. It works by repositioning and securing your own facial ligaments and superficial muscle, giving you a refreshed look that still feels like you. How does it compare to traditional facelift? A traditional facelift is more comprehensive, lifting both the mid and lower face, and often addressing the neck. It's best for more advanced signs of aging, but comes with a longer recovery and longer incision. The wave lift focuses on the early to moderate sagging of the lower face and jawline. It uses smaller incision and can be done under local anesthesia and has a recovery time of about 2 weeks, making it ideal for patients who want noticeable, yet subtle and natural results. A wave lift is perfect for people in their 30s to 60s who have mild to moderate sagging jowls or loss of jawline definition. If you're not quite ready for a full facelift but want to restore youthful contour, this may be the right choice. Before your wave lift, we'll meet for a consultation to review your goals, medical history, facial anatomy. I'll take a detailed photo and mark the areas that need lifting so we can plan every movement with precision. This step ensures your result will look natural and balanced. So what does the procedure involve? It involves, under either IV sedation with local anesthesia or general anesthesia, a small incision that starts at the level of the temple, and it follows the upper curvature of the ear, and it goes slightly behind the tragus area. So an incision that you can initially see is from the top portion of the tragus to the hairline. So a very small, limited incision. And through this incision, we insert a camera and we go underneath the muscle called the SMAS. So this procedure truly is a deep plane facelift. So we go underneath the muscle and we elevate and dissect the muscle. Although the incision is all the way back here, the level of dissection extends all the way up to the nasolabial fold. And by doing that, we can truly mobilize the entire soft tissue and elevate everything as one unit. And that's what keeps things more natural, as well as more of a definitive result. And because by lifting everything as one unit, there's less tension, you still look relaxed, although we get more lifting, and there is longevity. Typically, for most patients, the result will last anywhere from 7 to 10 years. The surgery itself is relatively quick, usually about an hour to hour and a half. Typically, we remove the sutures at around 10 days, and recovery time is anywhere from about 10 to 14 days. These days, everything is at the level of the deep muscle structure. However, it's not how much do you really pull on that muscle that's important. What's actually very important is how much do you elevate and dissect and free up the muscle before you do the lifting. Because the more that you can kind of free up that muscle from its attachment, by the time that you're ready to really lift to where you want it, everything moves up much easier, and therefore you get more lifting while you still look relaxed and not overly pulled. And because there's really not much tension, the result will last that much longer. After surgery, most patients have very minimal pain. However, there will be swelling and possibly some bruising. Typically though, the swelling is limited with wave lift because it's limited through a smaller incision. The dissection area is a little bit less, so there's less inflammation. So typically for a lot of patients, in about 10 to 14 days is when you can kind of expect maybe about 70 to 80% of the swelling to have gone away. That leftover 20 to 30% will slowly sort of subside over the course of next 1 or 2 months. With wave lift, it's important to kind of recognize that it only addresses the face only, that the neck portion, it does not include. and neither does it really address the eyes. Wavelift is really revolutionary because we can make a small incision and perform a deep plane facelift. It's not a skin lift, it's a true sort of a deep level smash repositioning. To learn more about this procedure, please visit worldsleadingclinics.com.